Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast for people with diabetes. The goal of our podcast is to empower you with knowledge. Today, we're going to focus on something that touches every single person living with diabetes, even if they don't always see or even realize that it's happening, and that is advocacy. The policies that are written in state capitals across the country and in Washington, D.C., have a direct effect on a lot of things, including how affordable your insulin is, what your insurance covers, how easy it is to get the technology you need, and even whether your child can manage their own diabetes safely at school. Today, we want to pull back the curtain on advocacy, what it is, why insulin affordability remains a critical issue. We're going to talk a bit about the Insulin Act of 2026 and the powerful role that your story can play in changing policy. I'm your host, Dr. Neil Skolnik, professor of family and community medicine at the Sidney Kimmel Medical College of Thomas Jefferson University and associate director of the Family Medicine Residency program at Jefferson Health Abington. And joining me today, as always, is my wonderful co-host, Lucia Novak. Lucia?
Thank you, Neil, and hello, everyone. I am a nurse practitioner and board certified in both adult and advanced diabetes management, and I own and am the president of Diabesity, which is located in North Bethesda, Maryland, and I see patients just like you, and maybe some of you are listening, with capital diabetes and endocrine associates, and they have offices in Silver Spring and Camp Springs, Maryland, which are located just outside of our nation's capital.
So you get a sense of what goes on in the Capitol. In addition, we are thrilled today to be joined by Lisa Murdock. Lisa is the Chief Advocacy Officer at the American Diabetes Association, where she leads the ADA's work at the federal and state levels to improve the lives of more than 40 million Americans living with diabetes. Lisa has spent her career fighting for policies that lower costs, expand access, and protect people with diabetes from discrimination. Lisa, we are so pleased to have you join us today. Welcome to our podcast.
Thank you. Thanks for the warm welcome.
So, Lisa, let's start with a question that I think a lot of our listeners may have, but may not even realize that they have. And people hear the words advocacy, they hear the words lobbying, but they're not always sure what that means or what it looks like day to day. How does the ADA work with lawmakers and decision makers to help improve the lives of people living with diabetes?
Sure. I think the old adage is all politics are local, and that's right. Lobbying advocacy starts from the ground up where you live in your communities and bubbles up. ADA is bolstered by nearly 500,000 advocates, and our role is to harness that power into a machine that has a strong presence at both federal level and in states across the country. ADA has a presence in all 50 states in the District of Columbia. We have a presence on Capitol Hill. We work with the administration. We work with entities that make decisions on key policies that impact the lives of people living with diabetes and prediabetes. On top of that, we have a really strong legal advocacy team that's focused on ending discrimination because all too often people with diabetes still face discriminatory practices in the school setting, in the detention setting, in the workplace. We want to make sure that people are not being unfairly discriminated against just because they have diabetes. One of the things that I've prioritized at ADA in this role is that advocacy and our advocacy team remains really nimble, responsive to opportunities and threats, and that we approach advocacy from a very holistic place where all parts of the machine are working together. If something's not happening on a federal level, immediately trigger a lever in the states to start movement. And we can talk about that a little later when we talk about insulin. But we look at all of these, we look at all the teams within advocacy to make sure that we are utilizing all the influence we have We're engaging our advocates to share their powerful voices and bringing all those forces to bear on key decision makers.
That is fantastic. So there are big issues. And then you mentioned the word threats. Can you give us an example what you mean by threats?
Sure. So we're responding to right now, but I think are really serious. One is the impact of HR1 and its implementation in the reduction or disenrollment of people off of Medicaid in states across the country. We know that at least 500,000 people with diabetes will lose their coverage as a result of that. And we're concerned about what that's going to mean. We're concerned about what the impact of the cuts will be to community health facilities, to rural hospitals where care is sparse and in between. How are we going to bridge that gap for people? Those are real questions and they impact people's lives. The other issue we're seeing right away is obviously changes to research. So the investment in research and perhaps the changes in proposals to research. Those things are very concerning to the American Diabetes Association and to the constituents we represent. We all want that research advancement. We all want a cure. We all want better treatments.
Yeah, so well said. And we live in an ever-changing environment, and it's really important for people to understand that it isn't just large issues that we've been working on for years, but it's, as you said, threats that may emerge that we might not even today predict over the next year. Can you back to policy, can you share an example or two of policy wins that the ADA was instrumental in helping achieve that have made a difference in people's lives?
Yeah, there's so many, and ADA has a track record of impactful change that either sweeps states, so a large majority of states, or is done at the federal level. I think insulin, and since we're talking about insulin today, is a strong and powerful story, and it's really a testament to our amazing advocates, elected officials, and our team who's worked tirelessly and continue to do that to ensure that everyone who relies on insulin or needs it to live has it and that it's affordable for them. I think sure you probably remember that back in the early 2000s, we started hearing from consumers and from clinicians that their patients were having trouble affording insulin. ADA put together an expert working group to research the issue. They published a paper, and that paper included some policy recommendations. The great work of that group led to some congressional hearings, but no definitive action. And we were really having trouble moving the needle. At the same time, we knew people were experiencing that more and more people were reporting rationing. We know that they were experiencing economic hardship. So in 2019, at the time I led the state government affairs team, we decided we were going to take a slightly different approach and look at this more holistically. What could we do to crack this problem or to solve this problem? So we decided that we would start approaching state governments to cap out-of-pocket costs on insulin at a rate that was reduced from what people were seeing. I had advocates send me copies of receipts for $1,300 a month. So that first attempt was really, how can we get that down to something that somebody can afford? So we started shopping that around in states, and a legislator in Colorado who'd had a family member die from diabetes took that on, and we had our first state copay cap bill passed in May of 2019. It was signed into law. Within 6 months, 30 plus states had similar laws on the books or the proposals for similar laws. Today, we are at 29 states and the District of Columbia. Now, the state laws are great. They provide economic relief to those who are experiencing, or on state regulated plans who are experiencing that pain. But at the same time, it did something else that was really important for us. And that something else was to create an echo chamber that we then could point to the federal government to say, you have to take some action. And I think that's when we really started seeing that change. Within a few years, we had the Medicare cap, out-of-pocket cost cap as part of the Inflation Reduction Act. And we came really close, I think within like 3 votes of getting it done in the commercial or private market as well, but fell short. And we've been working really hard since that time with many, many partners to try to close that final piece. But when you look at advocacy and how it all works, sometimes the approach that you think is the most expedient isn't the one that's going to ultimately be successful. In this case, we needed to take a step and go to the states and drive change to the states. Other times we've had campaigns with coverage for continuous glucose monitors and insulin pumps, where we really needed to approach from the federal side and then have states mirror. So ADA, I think, going back to my earlier statement, in that I want us to be nimble. I want us to be able to be responsive and take opportunities that we see, react to threats that we see in real time, but also utilize the levers in a more holistic way. So we're all working together on one strategy.
Lisa, I think what you present is just so important for our listeners. Both Neil and I see patients, and that issue of rationing insulin, rationing supplies, that's not abstract to us at all. In fact, I believe the latest data shows that for every 6 patients that is being seen that is on insulin, one of those 6 patients is somehow stretching out their insulin supply by either reducing their dose, skipping doses, whatever it takes for them to make that insulin last a little longer. And what we see on the end result of that is patients end up with very high blood sugars, can end up in the emergency room, maybe losing time at work, and some of them can even potentially lose their lives. So what I would like to do, if you wouldn't mind, is help us to understand how our patients can be advocates in that realm. Like, what stories can they provide you? You mentioned getting letters of receipts of how much insulin costs. What can they do to be proactive for themselves?
This is a kitchen table issue. It affects millions of Americans across the country. We need to put that phase. I think how our advocates are amazing. I am inspired by them continually. It is what bolsters us to do the work we do. But really sharing those stories. What does it mean to have to make a choice between healthcare costs and rent, or healthcare costs and utilities? How are people having to cut back? What is it? How does that impact them? Making those stories resonate to members or elected officials who have the power to make decisions is extremely important. We have to remember when we talk about lobbying and our elected officials, they have many issues to prioritize. Our job is to raise our voices and make them compelling so that they put us at the top of that list. And our advocates have done amazing work in that. I think the success we have is in large part testament to the fact that this issue resonates on both sides of the aisle. It's important. Everybody knows someone who's probably been impacted by this. And the more people who share their stories about what this is doing to them, the easier it is for our elected officials to prioritize this issue. So speak up, speak out, and contact ADA for help in doing that.
Lisa, it's so important for people to realize because I, for instance, live in a data-heavy world, an evidence-heavy world, but that's not what changes behavior. What changes behavior is the empathy we have for each other, and that empathy is often brought out by hearing the story of a single individual. Are there any stories that you might share with us that stand out in your mind as having made a difference, having impacted a lawmaker to take action?
Probably one of the most compelling stories that I've seen is a story about a young man who, when he went to college, he realized how much his parents were paying for insulin. And so he started rationing his insulin and he ended up in a healthcare situation. When his parents realized what was happening, they stepped in. But he put himself into jeopardy. He also felt tremendous guilt over what was happening, which is, just so awful considering, everybody people who rely on insulin, this was not something that it was in anybody's control. I mean, he desperately needed that insulin to remain healthy. But economic pressures are economic pressures. And he felt that for his family and realized what was happening for them. Legislators changed their minds. Hearing that story brought people about, even in my family, I had a brother who passed away from diabetes. If he had had the technology that exists today, he would not have. And so me sharing that story with legislators brings that home for them. People know people living with diabetes. People understand that there could be terrible consequences, but sharing those stories, making sure people understand the impact for what diabetes and prediabetes and obesity can have for people are tremendous. It's a tremendously important thing. And it's our privilege as the American Diabetes Association to harness those stories and the power of that network and make sure that we're elevating it to elected officials who can make key decisions.
Lisa, I'd like to kind of make this a little bit more user-friendly for the audience. I think when they hear talking to your congressional officials can be slightly intimidating. It's intimidating even for me as a healthcare professional. So they don't have to go to Washington, D.C. to meet with their congressional representatives, right? Like, what can they do at home, at the local level? Can you give some examples of how they can tell their story without traveling?
Thank you. Yeah. First of all, I'd say, to a person who's interested, you are the expert of your own story. Your story is powerful and no one can tell it better than you. ADA can find ways for people to do that at the level that they're comfortable with, whether that be just signing on to a petition or signing or sending an alert to and starting a dialogue with their member or Congress or their state elected officials that way. So we provide those mechanisms to make it easier. There are other opportunities too, joining a regional advocacy council or participating in a virtual meeting with members of Congress or state officials so that you're making that connection within a group of people. You can share your story, you can listen, but you're engaging. I mean, I would really encourage people to get plugged in and then let us help them find a way to engage at their level of comfort. ADA has a lot of issues to cover. We haven't even talked about our priorities, which are broad intentionally to allow us that flexibility to be where we need to be in the advocacy space. But I think, certain things resonate more with people. And I would really encourage people to go onto our website, diabetes.org/become an advocate, and find an issue that resonates with them and just plug in. Get involved and start that dialogue with us and that conversation so we can find matched for what they're comfortable with and what they really are motivated to engage on.
That sounds wonderful. Now, we started out talking about insulin. Can you update us on what the status of the congressional discussion on insulin is at this time?
So it's just terrific, by the way, to see such strong bipartisan support for this issue. The legislation is called the Improving Needed Safeguards for Users of Life-Saving Insulin Now, or the Insulin Act. It was introduced this year by Senators Shaheen, Collins, Warnock, and Kennedy. These four senators have been tireless champions on this issue, and we're so grateful for their continued support. We would love to get this across the finish line this year, close that final piece for the private market. The bill itself does a couple things. It extends the $35 monthly out-of-pocket cap to private or employer-sponsored commercial or insurance, And that's about 48% of the American public, by the way. So it's a large group of people that would then benefit from that cap. It creates a pilot program for those without insurance to enable them to also access affordable insulin. And it creates an expedited approval pathway for generic and biosimilar insulins to help increase commercial or competition in the market and ultimately drive down prices. That's what the legislation does. Right now, we're collecting co-sponsors, and the more support we have, the better. And so at this point, we have 26 co-sponsors, equal number of Democrats and Republicans. So we have strong bipartisan support. And I would encourage everyone right now, the best thing they can do is go online, sign a petition, and sign our Insulin Act petition, but also to engage with us. So you're getting regular alerts from us, you're getting updates from us, and you can easily weigh in with your member of Congress through our action alert process.
Lisa, where can they go to sign that petition?
So diabetes.org/insulin.
That is so helpful. And I would encourage all of our listeners to sign that petition, because it strikes me as you're talking that it takes an immense amount of organization, an immense amount of effort to make changes. And those changes don't occur quickly. You described all the things that happened over many years with insulin at state levels to accumulate the interest and power to address this at a federal level. And I hope people do appreciate the need for UNAdvocate, the American Diabetes Association, that brings all of the different advocacy efforts to bear. We're getting close to the end of our podcast. Can you remind people where to go to learn more about advocacy, to sign up for advocacy alerts, to share their story?
Sure. So diabetes.org is the place to start. You can look for the advocacy tab or go directly to diabetes.org/become an advocate. We also really want to hear people's stories, and we have a tool set up to collect that easily at diabetes.org/share your story. There are many ways for us to plug people in. We are excited to have advocates join us in these efforts. Again, our amazing advocates become the backbone of what we're doing and extend the reach. And really, we could not do that without them. So encourage everyone to join, find something that resonates with you, and plug in.
Yeah, never discount the power of your own story. Each of us has one. Each of us has many. Lucia, any final thoughts for our listeners?
Yeah, I would like to tell everyone out there, even if you're not currently using insulin in your management of the diabetes, it is a progressive disease. There is not a cure, and insulin may find its way into your life. So I want you to speak up, even if you're not using insulin. Get your friends and families to share that story as well. The more people we have advocating for each other, the better off we all are.
Wonderful. And Lisa, do you have any final thoughts for our listeners?
We've seen just such positive change in advocacy over the last, several decades. I'm inspired by the work we're doing and by the advocates who help us do this work. There's so much more to do, though, and we really have miles to go before anybody can kind of rest here. But together we can move the needle on policies that change lives. And I just want to welcome everybody and invite them into this journey with us.
So important. Lisa, thank you so much for joining Lucia and I in discussing advocacy.
It's my pleasure. Thank you.
And most of all, of course, we thank our listeners. Advocacy is not a spectator sport. It's something every one of us can be a part of, whether by sharing our story, sending an email to our representative, sometimes even showing up at a state house. Lisa has talked about how much ADA does to advocate for all of us. The lives of people with diabetes are improved when we put our voices together. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for listening.